Okay, so let's continue our discussion regarding uh, tumor markers. So let's start with prostate-specific antigen. So for prostate-specific antigen, it is secreted by prostatic epithelial cells, and although high levels of PSA are found in seminal fluid, very little PSA is found in the circulation of healthy men. And it is also produced by the periurethral and perirectal glands, and most PSA in the blood circulates complex to the serine protease inhibitors, alpha-1 anti-chymotrypsin, and also alpha-2 macroglobulin, and functions by digesting gel-forming proteins into smaller peptides. So regarding PSA, usually it circulates, or if it is present in the circulation, it's usually complex to serine protease inhibitors. Okay, so a minor fraction of PSA exists in the unbound form and lacks significant proteolytic activity. Now, PSA has replaced prostatic acid phosphatase in the management of known or suspected prostate cancer patients. So, regarding dealing with or the management of prostate cancer, uh, in the past, um, acid phosphatase is the substance usually used in order to help in the management of prostate cancer. But right now, uh, PSA is preferred over acid phosphatase, okay? Because it's more specific and sensitive compared to acid phosphatase in the management of prostate cancer, okay? Now, regarding PSA, PSA lacks sufficient sensitivity and specificity to be used alone as screening test for prostate cancer. So, you cannot rely lang sa PSA in the diagnosis of or screening test for prostate cancer. So you need other tests, uh, imaging tests in the diagnosis of prostate cancer. Okay, so uh, having a laboratory result is not enough to diagnose prostate cancer. Okay. Next, because PS is only organ specific and not tumor specific, there is considerable overlap in values obtained in patients with prostate cancer and those with benign conditions. Okay. Now, regarding PSA, another problem with PSA, it's also elevated in benign conditions like if there's hyperplasia, if there's enlargement, okay, of the prostate and prostatitis or inflammation of the prostate. So, another, vigorous prostate massage and needle biopsies can lead to significant increase in circulating PSA level. So there are conditions and activities that will lead to increase in the concentration of PSA. Okay, so it's not tumor specific. Okay, so there are other conditions or activities that will lead to increase in PSA level. But if we're going to compare PSA and acid phosphatase, it's better to use PSA, okay, compared to acid phosphatase. Now, let's continue with PSA. Significantly improved prostate cancer detection when used in conjunction with digital rectal examination and transrectal ultrasound. So to improve the detection of prostate cancer, you need to use the PSA value, okay, and imaging tests like transrectal ultrasound, okay, and also digital rectal examination, okay. So that's how prostate cancer is diagnosed. Another is through biopsy, okay. So next, PSA can be used to monitor patients with known prostatic carcinoma, okay. And the sensitivity of PSA can also be correlated with the disease staging. So usually, for stage 1 or stage A, 10% of patients with prostate cancer will have elevated PSA. For stage 2, 24% of patients with prostate cancer can elevated lang PSA. For stage 3, yeah, 53% of people or individuals with prostate cancer will have elevation in PSA. And for stage 4, 92%. Okay. Next, so after radical prostatectomy, okay, radiation therapy or androgen therapy, PSA values normally decline to undetectable levels. Okay, so you can use PSA to check for the effectivity of the treatment. Okay, so failure of PSA levels to become undetectable after therapy has been correlated with advanced disease stage. So if after therapy then PSA is still elevated, then it's correlated with advanced stage. So there's a possibility that prostate cancer is stage 4 na. Okay? And if you have stage 4 cancer, it will have poor prognosis, meaning you have low chance or probability or possibility na makarecover from that type of disease or to survive from that disease. Okay? Now, next is a rising PSA levels after therapy indicate recurrence. Okay, so meaning after surgery, there's decrease in PSA. Okay, decrease. It goes to undetectable level. And after a few months, there's recurrence. Or after a few months, there is increased na pod or rising levels of PSA. Then that is indicative that there's recurrence or relapse of the disease. Okay, or prostate cancer. Okay. So next tumor marker you have human chorionic gonadotropin, so HCG. So it's also used to confirm pregnancy, but it's also a tumor marker. Okay. So during pregnancy, HCG is synthesized by the syncytiotrophoblastic cells of the placenta, and it's found in trace amounts in healthy men and non-pregnant women and becomes markedly elevated in the circulation during pregnancy, reaching a peak 8 to 10 weeks after conception. Okay. Serum or urine HCG is routinely measured to confirm pregnancy. That's the main purpose of HCG. But as a tumor marker, beta HCG is used for the diagnosis and management of gestational trophoblastic disease, which consists of complete and partial hydatidiform mole, gestational choriocarcinoma, and placental site trophoblastic tumor. Okay. Another thing regarding HCG, it is also useful for accurate staging and for monitoring the response to treatment in germ cell tumors of the testis and ovary. So if a man, okay, has high levels of HCG, the usual or the common cancer associated with that HCG elevation in men is testicular cancer. Okay, for women, possible that there's ovarian cancer, but for men, it's testicular cancer. Okay, so you can use HCG for monitoring the response to treatment or for accurate staging of the disease, but you cannot use this one to diagnose. Okay, there are other tests to diagnose ovarian and testicular cancer. Okay, so usually HCG is for staging uh, and to monitor the response to treatment. Okay, it is also observed in ovarian cancer, breast cancer, melanoma, GIT neoplasm, sarcoma, lung cancer, renal cancer, and hematopoietic malignancies. And if there's persistent elevation of HCG after therapy, it indicates residual disease or there is recurrence. Okay, residual disease meaning not complete removal of the cancer cells during surgery. Okay, or napay staying a small amount of cancer cells in the body. Okay. Next, you have HPL or human placental lactogen. So a trophoblastic hormone that is normally produced by syncytiotrophoblastic cells of the placenta. And it's present in the serum of pregnant women and has been used as an index of placental function and fetal well-being. So elevated levels of HPL are associated with trophoblastic neoplasm. So gestational, gonadal or extragonadal. And although levels are not as high as those observed in pregnancy, levels of HPL correlate with fetal and placental weight, reaching a plateau in the last month of pregnancy and becoming extremely low or undetectable 24 to 48 hours postpartum. Next, you have placental alkaline phosphatase. So it is an isoenzyme of alkaline phosphatase synthesized by placental trophoblast. So pulp or placental alkaline phos is normally found in the serum of pregnant women. Okay. In 1968, Regan isoenzyme was identified in serum and tumor tissue from a patient with lung cancer. So, meaning, Regan isoenzyme of pulp is associated with lung cancer. Okay. In adults, pulp gene is normally repressed, but Regan isoenzyme can be produced in various diseases as a slightly modified form of pulp. Okay. Then pulp can be differentiated from other isoenzyme of alkaline phosphatase by its remarkably heat stability. So it's the most heat stable isoenzyme of alkaline phosphatase. So pulp is elevated in about 10 to 20% of patients with a wide variety of malignancies such as lung, ovarian, gastrointestinal, and trophoblastic cancers. Okay, so there are a lot of types of cancer that is associated with increase in placental alkaline phosphatase. Okay, so Regan is a type of placental alkaline phosphatase. Okay. Next, you have prostatic acid phosphatase or acid phosphatase, one of the first laboratory tests used for the diagnosis of cancer. And although acid phosphatase is produced primarily by the prostate gland, it is also found in bone, liver, spleen, kidney, bone marrow, and several cell types. That's why if we're going to compare PSA and POP or prostatic acid phosphatase, today PSA is superior compared to superior than prostatic acid phosphatase. Okay. POP can be distinguished from other sources in enzymatic assays by using substrates such as thymophthalate monophosphate. So for ACP or acid phosphatase, if you want to measure uh, the prostatic isoenzyme of ACP, then use the substrate thymophthalate monophosphate because it's the more specific substrate for its specific, okay, to acid phosphatase, the prostatic acid phosphatase. Okay, thymophthalate monophosphate. Instead of using p-nitrophenyl phosphate, because you can use p-nitrophenyl phosphate for acid phosphatase. Now, if you want to measure the prostatic acid phosphatase, then use thymophthalate monophosphate. Okay, as substrate. Okay. Next, POP is not sensitive enough to be used as screening test and is not suitable for detecting prostate cancer in the early stages of the disease because it's elevated in other types of benign disease. Okay, so you cannot use this one for early detection, okay, of prostate cancer. The only area in which POP may be superior to PSA is in selecting those patients with metastatic disease who are not candidates for surgery. Okay, so for example, if high na jud kay ang PAP, meaning ang metastasis ana is grabe na. So there are uh, individuals nga dili na good for surgery. Okay? It's because highly metastasized na ang uh, cancer. Okay? So sometimes useless na ang surgery because ni metastasize na ang cancer cells. Okay, so daghan na kayo nakaspread na. Then next is creatine kinase BB isoenzyme. So it's found in prostatic carcinoma and metastatic cancer of the stomach. So creatine kinase BB or CK1. Okay, it's also a tumor marker. Okay, so it's associated with prostatic carcinoma or metastatic cancer of the stomach. Okay, so I think that's all regarding tumor markers. Okay. Those are the tumor markers usually or commonly performed in the clinical laboratory. Okay, so thank you and God bless.